Overweight and obesity are associated with a range of serious health problems affecting various systems and functions in the body. Here's a detailed look at each of the health issues. So asthma. Obesity can increase the risk of developing asthma and exacerbate existing asthma symptoms. Excess body weight can lead to inflammation and altered lung function, making it harder to manage asthma. Cancer, and this is looking at different types. So obesity is linked to an increased risk of several cancers, including breast, colorectal, endometrial, and prostate cancers. Excess fat tissue can produce hormones and growth factors that promote cancer cell growth. Cardiovascular disease. Obesity contributes to a cardiovascular disease by promoting hypertension, dyslipidemia, and insulin resistance, which can lead to coronary artery disease, heart attack, and stroke. Cognitive decline, dementia, and Alzheimer's disease. Also, obesity is associated with an increased risk of cognitive decline and neurodegenerative diseases like Alzheimer's. The chronic inflammation and insulin resistance associated with obesity can impact brain health. And type 2 diabetes. Obesity is a major risk factor for type 2 diabetes. Excess fat, particularly abdominal fat, can lead to insulin resistance when the body does not effectively use insulin to regulate blood sugar levels. And dyslipidemia. So obesity often leads to dyslipidemia, characterized by abnormal levels of lipids in the blood, such as high cholesterol and triglycerides, increasing the risk of cardiovascular diseases. Gallstones. Obesity increases the risk of developing gallstones due to altered cholesterol metabolism and increased cholesterol secretion into the bile. Gastrointestinal reflux. So excess body weight can increase abdominal pressure, leading to gastrointestinal reflux disease or worsening its symptoms. And gout. Obesity is associated with an increased risk of gout, a type of arthritis that is caused by the buildup of uric acid crystals in the joints, partly due to increased production of uric acid. And hypertension. Excess weight can lead to elevated blood pressure, increasing the risk of hypertension. Obesity can cause changes in blood vessel structure and function, contributing to high blood pressure. And insulin resistance. Obesity is a key factor in the development of insulin resistance, where the body's cells become less responsive to insulin, leading to elevated blood sugar levels and higher risk of type 2 diabetes. Excess weight, particularly in the abdominal area, can place stress on the lower back, leading to pain and discomfort. And low-grade inflammation. Obesity is associated with chronic low-grade inflammation, which can affect various tissues and organs and is a precursor to several obesity-related conditions. And anxiety and depression. Obesity can increase the risk of mental health issues such as anxiety and depression. The psychological impact of obesity, along with associated physiological changes, can contribute to these conditions. Osteoarthritis and knee pain. Excessive body weight can put additional stress on weight-bearing joints such as the knees, leading to osteoarthritis and joint pain. And respiratory dysfunction. Obesity can impair respiratory function due to increased abdominal pressure and altering the lung mechanics, leading to conditions like obstructive sleep apnea and reduced lung capacity. And then sleep apnea. Obesity increases the risk of obstructive sleep apnea, a condition where the airway becomes blocked during sleep, leading to poor sleep quality and associated health problems. And social isolation. Individuals with obesity may experience that social stigma and discrimination, leading to social isolation and impacting mental well-being. And stroke. Obesity is a factor for stroke, primarily due to its impact on cardiovascular health, including hypertension and dyslipidemia. And vertebral disc herniation. Excess weight can contribute to increased pressure on the spine, leading to conditions such as vertebral disc herniation, which can cause significant pain and mobility issues. Adipokines are bioactive molecules secreted by adipose tissue that plays significant roles in regulating various physiological processes, including cardiovascular health. Their effects can be both beneficial and detrimental, depending on their nature and the context in which they are acting. Here's a detailed look at some key adipokines and their roles. Adiponectin is anti-inflammatory, and its role in heart health is generally considered beneficial for cardiovascular health. It has anti-inflammatory and anti-arthrogenic properties, which means it helps reduce inflammation and prevents the buildup of fatty deposits in blood vessels. Adiponectin enhances endothelial function, promotes insulin sensitivity, and can help protect against heart disease. Resistin is pro-inflammatory. Its role in heart health is associated with inflammation and insulin resistance and may contribute to endothelial dysfunction and atherosclerosis, but by promoting inflammatory processes in blood vessels. High levels of resistance are often observed in conditions like obesity and type 2 diabetes, which are risk factors for cardiovascular disease. And tissue necrosis factor, or TNF, is pro-inflammatory. So TNF alpha is a key pro-inflammatory adipokine that can negatively impact cardiovascular health. It is involved in the inflammatory response and can contribute to endothelial dysfunction, atherosclerosis, and insulin resistance. Elevated levels of TNF alpha are linked to increased risk of heart disease and other inflammatory conditions. And bisfatin is pro-inflammatory. Its role in heart health: bisfatin is also known as nicotinamide adenine dinucleotide, or NAD, dependent deacetylase sirtuin, or SIRT1, is another adipokine with pro-inflammatory properties. It has been linked to obesity-related inflammation and may contribute to cardiovascular risk by promoting inflammatory processes and affecting endothelial function. The location of fat in the body, often referred to as a regional fat distribution, plays a significant role in determining the health risks associated with obesity. Here's how different types of fat distribution impact health. Android type obesity. With this, the location is in the abdominal region, primarily visceral fat. So fat is stored around internal organs. Now, the health implications with that are that you're at an increased risk of cardiovascular disease. So visceral fat is metabolically active and secretes inflammatory cytokines and adipokines that can contribute to endothelial dysfunction, increased arterial stiffness, and higher risk of hypertension and coronary artery disease. There's also a higher risk for type 2 diabetes. The visceral fat is associated with insulin resistance, which can lead to the development of type 2 diabetes. The proximity of the visceral fat to the liver can lead to increased hepatic glucose production and impaired insulin action. And inflammation. The visceral fat contributes to chronic low-grade inflammation, which is linked to various health issues, including cardiovascular disease, metabolic syndrome, and certain cancers. There's also hormonal changes. It may alter levels of hormones involved in appetite regulation and metabolism, exacerbating weight gain and metabolic problems. So you see here, it's depicted on the picture there as A. Now, gynoid type obesity is typically in the gluteal femoral region. So fat is stored in the hips, buttocks, and thighs, and you see that the health implications to that are that they're at a lower risk of cardiovascular disease. The fat in the gluteal femoral region is generally considered less harmful than visceral fat. It tends to have a less adverse impact on metabolic health, and it is associated with a lower risk of cardiovascular disease. There is an improved insulin sensitivity. So gynoid fat may be associated with better insulin sensitivity compared to abdominal fat. This type of fat has been shown to be less metabolically active and less likely to contribute to systemic inflammation. There are some protective effects that some studies have suggested that fat stored in the hips and thighs might have protective effects against certain metabolic disorders. potentially due to its role in storing excess energy in a less harmful way. So the gynoid type obesity you see here depicted in the picture as C. The android type obesity, you have A and B. It's just a female and a male depicted. So go into a little bit more detail in android type obesity. It involves the accumulation of fat primarily in the abdominal region, particularly as deep visceral fat. This type of fat distribution is associated with several negative health outcomes. The release of harmful adipokines. These are signaling molecules secreted by adipose tissue in android type obesity. The visceral fat cells release adipokines that can be detrimental to health, and it includes substances such as resistant and tumor necrosis factor alpha, or TNF alpha, which can contribute to inflammation and other metabolic disturbances. The triggering inflammation and coagulation. So visceral fat is highly metabolically active and secretes inflammatory cytokines like TNF alpha and interleukin 6. Chronic inflammation can damage endothelial cells and blood vessels, promoting atherosclerosis and increasing the risk of cardiovascular diseases. With coagulation, the inflammatory environment created by visceral fat can also influence coagulation pathways, increasing the risk of blood clot formation and thrombotic events. It also induces insulin resistance. The resistin, which is the adipokine which is elevated in visceral fat, is linked to insulin resistance. That resistin impairs insulin signaling pathways, leading to higher blood glucose levels and an increased risk of type 2 diabetes. With insulin resistance, this condition occurs when cells become less responsive to insulin, causing glucose to accumulate in the bloodstream and potentially leading to diabetes. Decreasing release of protective adipokines. So adiponectin is a protective adipokine that has anti-inflammatory and insulin sensitizing effects. In individuals with android type obesity, the levels of adiponectin are often decreased, and reduced adiponectin lower levels can contribute to increased inflammation and worsened insulin sensitivity, compounding the risk of metabolic disorders. This all may lead to a metabolic syndrome, which is a cluster of conditions that occur together, increasing the risk of heart disease, stroke, and type 2 diabetes. It includes abdominal obesity, insulin resistance, hypertension, and dyslipidemia, which is abnormal lipid levels. And the role of visceral fat is a central component of metabolic syndrome, as it is strongly associated with all of its key features. Metabolic syndrome, also known as cardiometabolic syndrome or syndrome X, is a collection of interrelated health conditions that increase the risk of developing cardiovascular disease, type 2 diabetes, and other serious health issues. Here's a comprehensive overview of its key components. It is a cluster of symptoms. So hyperinsulinemia is elevated levels of insulin in the blood, often due to the body's attempts to compensate for insulin resistance, and can lead to increased fat storage and contribute to metabolic dysfunction. Insulin resistance is a reduced effectiveness of insulin in promoting glucose uptake by cells. It results in higher blood glucose levels and is a key factor in the development of type 2 diabetes. Impaired glucose tolerance is a reduced ability to process glucose effectively, leading to elevated blood sugar levels, and it is often a precursor to type 2 diabetes. Now, hypertriglyceridemia is elevated levels of triglycerides, a type of fat, in the blood, and it increases the risks of cardiovascular diseases. If we look at cholesterol, increased small, dense LDL cholesterol particles, or low-density lipoprotein. It is a type of low-density lipoprotein, or LDL cholesterol, that is more atherogenic, which promotes the formation of plaques in the arteries. It is associated with a higher risk of atherosclerosis and heart disease. And then we have decreased HDL cholesterol. So low levels of high density lipoprotein or HDL cholesterol, which is considered protective against heart disease. And we often see this when we increase exercise. But the lower HDL levels are associated with an increased risk of cardiovascular events. Hypertension, which is high blood pressure, puts a strain on the cardiovascular system and increases the risk of stroke, heart attack, and kidney disease. And then we have increased plasma fibrinogen and clotting activity. This is elevated levels of fibrinogen, which is a protein involved in blood clotting, and increased tendency for blood clot formation. It contributes to a higher risk of thrombotic events and cardiovascular diseases. And then we fall back on the android pattern of fat deposition that we talked about earlier. It is an accumulation of fat primarily in the abdominal region or visceral fat. And this fat distribution is linked to the other components of metabolic syndrome and poses a higher risk for cardiovascular diseases and type 2 diabetes. So some components of metabolic syndrome are, again, abdominal obesity, often assessed by waist circumference. High levels of abdominal fat are linked to greater health risks than fat distributed in other areas. Elevated blood pressure, which is hypertension or high blood pressure, is a common component. High blood sugar, so elevated fasting glucose levels or insulin resistance. And dyslipidemia, abnormal levels of lipids in the blood, such as high triglycerides and or low HDL or high density lipoprotein cholesterol. And then risk factors. The metabolic syndrome is associated with increased risk of cardiovascular disease due to factors like hypertension, dyslipidemia, and abdominal obesity. There is an increased risk of type 2 diabetes. So insulin resistance, a core component of the metabolic syndrome, can lead to the development of type 2 diabetes. Approximately 25% of American adults have 3 or more components of metabolic syndrome, indicating a substantial public health concern. And with BMI or body mass index and waist circumference, typically what we find again is normal BMI is 18.5 to 24.9 or overweight BMI 25 to 29.9. Now, individuals within these BMI ranges may still exhibit components of metabolic syndrome if they have high waist circumference. This highlights the importance of considering waist circumference as a crucial measure of abdominal obesity and health risks beyond just BMI. Now, as far as management and prevention, weight loss and lifestyle changes are really important. So increased physical activity and a healthy diet are key strategies to manage and potentially reverse metabolic syndrome. Metabolic management, medical management is necessary to address specific components such as high blood pressure, high blood sugar, or dyslipidemia. The prevalence and demographic factors of metabolic syndrome, if we look at age and BMI specifically, there is an increased risk of metabolic syndrome with age. The prevalence generally increases with age. It's often due to the cumulative effects of aging on the metabolic processes, increased likelihood of obesity, and the development of other risk factors. Now, in relation to the BMI correlation, the higher body mass index is strongly associated with an increased risk of metabolic syndrome. As BMI rises, so does the risk of developing the components of metabolic syndrome, particularly abdominal obesity. Looking at race, ethnicity, and gender, there are some interactions like non-Hispanic white males. This group has been observed to have a higher risk of metabolic syndrome compared to other racial and ethnic groups. Non-Hispanic Black females. This is similarly, they're also at a high risk. The factors may include socioeconomic conditions, genetic predispositions, and lifestyle factors. And low education. Lower levels of education are linked to higher risk, possibly due to associated socioeconomic factors that influence lifestyle and health behaviors. And advanced age. An older age is a significant risk factor, reflecting the cumulative impact of lifestyle and metabolic changes over time. Now, looking at trends in adolescence from 2011 to 2016 with the NHANES data, according to research by Gastron and colleagues, there was a range in prevalence rates of metabolic syndrome among U.S. adolescents aged 12 to 19 years, with notable differences between the genders. For females, there's approximately a 2% prevalence versus males, where it was approximately 11%. Now, the figures reflect a significant gender disparity, with adolescent males showing higher rates of metabolic syndrome compared to females. If you look at waist circumference criterion with the Wong analysis, the international criteria, the data analyzed by Wong from the same period showed that the average U.S. adult male and female meet the international waist circumference criterion for metabolic syndrome. This indicates a widespread issue with abdominal obesity in the U.S. adult population, aligning with the increased risk of metabolic syndrome. In 2009, Alberti and colleagues representing various international societies established consensus criteria for diagnosing metabolic syndrome. These criteria involve measuring waist circumference and at least 2 of the 4 additional components. Here's a summary of the criteria. So waist circumference for males would be greater than 40 inches. Or 102 centimeters. For females, it's above 34.6 inches, again, considered to be metabolic syndrome. Now, some alternative criteria. Some experts recommend lower waist circumference thresholds. So for males, greater than 37 inches, or females greater than 31.5. Now, there are some subnormal HDL cholesterol criteria that are added to it as well. For males, again, this is HDL, so this is the good cholesterol. And so for males, if it is under 40 milligrams per deciliter, or for females below 50 milligrams of deciliter. So low levels of HDL cholesterol, which again is protective against cardiovascular disease. Other criteria are elevated serum triglycerides, and with both male and female, anything over 150 milligrams per deciliter. So high levels of triglycerides, a type of fat found in the blood, can increase cardiovascular risk. And elevated blood pressure. So again, for both males and females, anything over 130 for the systolic blood pressure and over 85 on the diastolic blood pressure. So high blood pressure, which contributes to cardiovascular disease and other health issues. Elevated fasting blood sugar, both males and females, anything over or equal to 100 milligrams per deciliter. So again, higher than normal fasting blood glucose levels, indicating insulin resistance or pre-diabetes. Android type obesity, characterized by fat accumulation primarily in the abdominal region, is a significant risk factor for various health conditions and mortality. So there is an increased mortality due to cardiovascular disease. Again, android type obesity, it's primarily due to the presence of the visceral fat, which can lead to inflammation, insulin resistance, and atherosclerosis. Abdominal fat is linked to increased risk of several types of cancer, including breast, colon, and pancreatic cancer. This is thought to be due to inflammatory and hormonal changes associated with the visceral fat. And there is an impact on normal weight women. Even women who are classified as normal weight but have an android fat distribution are at an increased risk for health issues, typically associated with obesity. This highlights the importance of fat distribution and not just overall body weight in assessing health risks. Weight loss and abdominal fat So the effectiveness of dieting and exercise, the weight loss strategies, particularly those involving the diet and exercise, are effective in reducing abdominal fat. Thus, reduction in visceral fat can significantly lower the risk of related health conditions. Even modest weight loss can lead to improvements in several risk factors associated with metabolic syndrome, including reduced blood pressure, improved insulin sensitivity, and lower triglyceride levels. Losing excess body fat can significantly reduce health risks and improve health status. Here's how weight loss impacts health, particularly the reduction of visceral fat and the role of specific diet plans. It's that reduction of the metabolic syndrome risk factors. So the visceral fat, the excess visceral fat, which accumulates in the abdominal area, again, is closely linked to that metabolic syndrome. So losing that fat can lead to lower blood pressure and lower the risk of hypertension. Weight loss enhances insulin sensitivity and helps regulate blood glucose levels, reducing the risk of type 2 diabetes. And weight loss can lower elevated triglyceride levels, which reduces cardiovascular risk. The health benefits of targeting abdominal fat with weight loss through dieting and exercise, preferentially, it reduces abdominal fat. This reduction has been shown to improve several metabolic syndrome components and reduce overall health risks. In addition to reducing fat, weight loss can improve inflammatory markers and enhance overall metabolic health. There are some effective diet plans, the DASH diet, which is dietary approaches to stop hypertension. It's designed to combat high blood pressure, and it emphasizes fruits and vegetables, which are rich in vitamins, minerals, and fiber, whole grains, which provide complex carbohydrates and additional fiber, and lean proteins, which include sources such as poultry, fish, and legumes. Low-fat dairy, helping to manage blood pressure and support overall health, and low sodium, which reduces blood pressure and associated risks. So it's been effective in reducing blood pressure and improving cardiovascular health. The Omni Heart diet. It's a flexible diet that includes 3 variations. High carbohydrate, which emphasizes whole grains, fruits, and vegetables. High protein, which includes lean meats, poultry, and fish. And high unsaturated fat, incorporating healthy fats like those from nuts and olive oil. And basically, it aims to improve cardiovascular risk factors and metabolic health by providing balanced macronutrient options. Being physically fit does offer significant health benefits and can mitigate some of the adverse effects associated with being overweight. However, while fitness can improve many health markers, it does not completely negate the risks associated with excess body fat. So the benefits of physical fitness are there's an improved metabolic health with the increased insulin sensitivity, which helps in managing blood glucose levels and reducing the risk of type 2 diabetes. Exercise is effective in lowering blood pressure, which can reduce the risk of hypertension and related cardiovascular conditions. And it counteracts the effects of fatness. And so it's fitness versus fatness. Some studies suggest that high levels of physical fitness can counteract some of the adverse effects associated with obesity. For example, fit individuals with obesity might have better cardiovascular health and metabolic profiles compared to unfit individuals with the same level of excess body fat. Individuals who are overweight or obese but physically active and metabolically healthy with normal blood pressure, lipid levels, and glucose levels might have a lower risk of mortality and cardiovascular events compared to those who are both overweight and unfit. There have been some studies conducted by Kramer and colleagues, and basically what they have found is that there is a risk comparison. And so that is found with the metabolically healthy individuals with obesity. They had a slightly higher relative risk, about 1.24 times for all-cause mortality and cardiovascular events compared to metabolically healthy individuals of normal weight. This indicates that while physical fitness can improve health outcomes, excess body fat still carries some risk. The benefits of exercise are optimized when combined with weight loss. So reducing excess body fat through both diet and exercise is more effective in reducing health risks than relying on physical fitness alone. So some key concepts. Excessive body fat is associated with a variety of chronic diseases and impaired health conditions, including cardio heart disease, type 2 diabetes, high blood pressure, sleep apnea, and arthritis. Although having obesity increases health risks, the deposition of fat in the abdominal area exacerbates these risks. Referred to as android type or apple type or even male type obesity, it is, and even though it's called male type obesity, women can have that same makeup. There is an increased abdominal fat that is associated with metabolic syndrome and risk factors for heart disease and type 2 diabetes. For children and adolescents, having obesity and abnormally elevated body fat increases risk for type 2 diabetes, metabolic syndrome, and other forms of chronic disease as well. Obesity may also increase risk of anxiety and depression. So engaging in regular physical activity is important to not only supporting a healthy body weight and body composition, but also in preventing chronic disease. Thank you for visiting with me today. I look forward to talking with you again. We're going to be going into chapter 11. Now, I will tell you there's still more to this chapter, and I'm going to leave it up to you to read through that. So, all right, I look forward to talking with you again. Have a great day.